I am so excited to introduce what probably is a new face to you, certainly here at WEFTEC. It's Dr. Andrew Sanderson. And Dr. Sanderson is the first Chief Medical Officer for WEF. Welcome, Dr. Sanderson.
Thank you. Good morning.
Well, this is exciting. So Dr. Sanderson is the Chief Medical Officer at WEF. He's also an adjunct associate professor at Howard University Graduate School and a practicing physician. Now, what I think is really neat is that Dr. Sanderson came in as a chief medical officer for WEF to really help provide reliable medical information to the entire water sector and really serve as a spokesman on medical issues. I mean, you're also a gastroenterologist and, like I said, associate professor at Howard. But Dr. Sanderson comes to us after having served as a medical officer at the U.S. Department of Health and Human Services, a fellow at Harvard Medical School, and chief of the Division of Gastroenterology at Howard University Hospital. I mean, you've got your master's in public health from Harvard University, your doctor of medicine from Howard University, and your bachelor of science in biology from Morehouse. So Dr. Sanderson, you've got the accreditation. I know that you're talking about results. Thank you for being with us.
Glad to be here.
Now, Dr. Sanderson just joined, what, a year ago in July, maybe a year and a couple of months?
Yep, a year ago in July.
So this is your first WEFTEC.
It is, and it's very exciting to be here to listen to all the new technology that's out and just to interact with all these water professionals.
Yeah, it really is nice to interact in person, and everybody will have a chance to interact online as well in November. I want to ask you, what are your observations, Dr. Sanderson, from this past year as the WEF CMO?
So, first off, being the WEF CMO is really important to me because I have an opportunity to protect the health of water treatment professionals, and so that's my main focus. And so when I first started, COVID was, really an interesting concern. A lot of people had a lot of anxiety about it. And so having the opportunity to review data and reassure people that they could work in a safe way was great. Being able to move from seeing patients one by one to kind of a more upstream, public health and big picture focus is something that I really appreciate. And lastly, it's very heartening to see that WEF has a focus for water equity and environmental justice.
It has been a tremendous conversation that really has been brought into every conversation at WEF and here at WEFTEC. When it comes to innovation, research, all of it has really come back to equity and inclusion and diversity, and it's great to see that carried through. It's also so neat to see WEF invest in a CMO because everyone here are essential workers.
Absolutely.
And they've found themselves on the front line during some of the most discontented times. So having you aboard is something I can say on behalf of WEC and everybody here, thank you. So I want to talk a bit about wastewater surveillance because this really is public health even beyond COVID. So what is wastewater surveillance and its role in protecting public health, Doctor?
Yeah. So wastewater surveillance is actually something that's been done for about 20 years, testing the water, seeing what pathogens are in there, what chemical contaminants are in the water, and how they may affect human health. And so it's been particularly important with this pandemic because we're able to use a large pooled sample. Right?
Yeah.
Everyone has to go to the bathroom, whether they're symptomatic or asymptomatic. And so we're able to identify communities where SARS-CoV-2 or other pathogens are spiking in a very rapid way.
And then can you then contact that community to then take that data into precautions that they need to take or to see the trend lines?
Well, that's what we're hoping to do. So WEF has a cooperative agreement with the CDC.
Yeah, which is really exciting. A new pilot program with the CDC.
Yeah, so it's called NEWS, and it's the National Wastewater Surveillance System. And so WEF is partnering with utilities around the country to develop algorithms so that we are able to actually use that data in a way that's actionable for public health and other professionals and leaders in cities to try to address those type of concerns.
Has it been exciting partnering with the CDC in regards to that? Because that program hadn't been in existence.
Correct. Yes, it's very exciting to be working with the CDC. Obviously, they've been the experts in disease and epidemiology and keeping our country safe for decades.
Yeah, but now with their partnership with WEF, they can now attribute a lot of great resources to being aligned with WEF. Again, the acronym for the program is NEWS.
Yes, NWSS.
NWSS, and that's National
Wastewater Surveillance System.
There you go, the National Wastewater Surveillance System. It's really going to be interesting to keep up with that and see where that goes and the impact, the tremendous impact that WEF will have. So let's go and talk about drinking water and wastewater. Where do you see the role, Dr. Sanderson, at drinking water and wastewater systems have in both building and maintaining healthy communities?
Right. Well, as you know, water is the foundational element that you need for health, right? And so having access to clean water and sanitation is one of the United Nations Sustainable Developmental Goals.
Yes,
right?
I believe it's number 6.
Number 6,
is it?
Correct.
Everybody, I love seeing the UN Sustainability Goals pins on so many folks. So.
Yes, and so as we should be, WEF is focused on trying to implement that goal around the world. But, it's surprising to many people in the United States, with a country with as many resources as we have, that there still is a water access gap. And so the U.S. Water Alliance, as well as Dig Deep, put out a report a couple years ago talking about what do we do to close this water access gap, because there are people who don't have access to clean sanitation, and because of that, they're developing parasitic diseases and other waterborne illnesses that they shouldn't have.
Right.
And I couldn't imagine, I'm sure you couldn't, trying to get through a day without having, access at the tap to clean water. And so being able to work in this industry has been, very energizing for me because these are problems that we see as physicians when patients come into the clinic or into the hospital, but being able to work on the root cause to try to keep people healthy is very.
It really is interesting how water is such a part of prevention.
Yes. When
you think about it in that direction. Thank you so much for the forward moves on that. With all the water professionals with us today live and here from public works around the country, what steps can public works professionals take to really best engage with public health professionals to help one another beyond your role at WEF, but how can all these public water professionals really take on that role themselves? Yeah,
I think as with everything else, communication is key. You start out with framing what the problem is and then coming up with ideas. So being able to sit together in a room and discuss a certain issue is really important. WEF is planning a conference, a public health and water conference in March of 2022.
Oh, fantastic.
So that we can address some of these concerns head on and try to bring these two industries together.
That's great. So watch for that next spring, the Public Health and Public Works Conference together. I mean, that really is an alliance that, if you look back, could have been made years ago, but now it's more relevant than ever. So fantastic. Lastly, just as we close out, ideally, Dr. Sanderson, with all of your knowledge and with your involvement with WEF, where do you think the union of public works and public health will be 10 years from now?
Well, I think news is a great start because it will provide, a roadmap for that.
Yeah.
I think ideally you would want to have a public health officer either embedded in a public works department or have strong lines of communication with the public health department. So I think in 10 years we'd like to be a lot more streamlined with information so that we can identify threats or identify root causes and begin to act on them quickly.
Well, Dr. Sanderson, it's interesting to see how you've reacted on everything so quickly since day one, July of last year, joining WEF as their first ever Chief Medical Officer. I join WEF in welcoming you and thanking you for all of your doing. And really, WEF not only is a powerful organization, but it serves to empower others, and that's exactly what you're doing through the public works and public health sector. Thank you so much for joining us.
Thank you. It's a pleasure.
Awesome. Dr.